Sinusitis is an inflammation of the tissues in your sinuses, the spaces in your forehead, cheeks and nose usually filled with air. It causes facial pain, a stuffy or runny nose, and sometimes a fever and other symptoms. It's usually caused by the common cold, but other viruses, bacteria, fungi and allergies can also cause sinusitis. Welcome to Channel Health N Alerts. A well-informed person is more likely to survive longer and have a better quality of life than an uninformed one. Sinusitis is an inflammation or swelling of the tissue lining your sinuses. Sinuses are structures inside your face that are normally filled with air. Bacterial infections, viral infections, and allergies can irritate them, causing them to get blocked and filled with fluid. This can cause pressure and pain in your face, nasal congestion, a stuffy nose, and other symptoms. Sinusitis is also sometimes called rhinosinusitis. Your sinuses are four paired cavities, spaces, in your head. Narrow passages connect them. Sinuses make mucus that drains out of the passages in your nose. This drainage helps keep your nose clean and free of bacteria, allergens, and other germs, pathogens. Types of sinusitis. We describe types of sinusitis based on how long it's been going on: acute, subacute, chronic or recurrent, and what's causing it: bacteria, virus or fungus. Acute sinusitis symptoms: nasal congestion, drainage, facial pain/pressure, and decreased sense of smell. Last less than 4 weeks. Viruses like the common cold usually cause it. Subacute sinusitis symptoms last 4 to 12 weeks. Chronic sinusitis symptoms last at least 12 weeks. Bacteria are usually the cause. Recurrent acute sinusitis symptoms come back 4 or more times in 1 year and last less than 2 weeks each time. Bacterial and viral sinusitis viruses, like the ones that cause the common cold, cause most cases of sinusitis. Bacteria can cause sinusitis, or they can infect you after a case of viral sinusitis. If you have a runny nose, stuffy nose, and facial pain that don't go away after 10 days, you might have bacterial sinusitis. Your symptoms may seem to improve, but then return and are worse than the initial symptoms. Antibiotics and decongestants usually work well on bacterial sinusitis. Fungal sinusitis. Sinus infections caused by fungus are usually more serious than other forms of sinusitis. They're more likely to happen if you have a weakened immune system. How do I know if I have sinusitis, COVID, a cold, or an allergy? Colds, COVID-19, allergies and sinus infections all have similar symptoms. It can be difficult to tell them apart. The common cold typically builds, peaks, and slowly disappears. It lasts a few days to a week. Nasal allergies cause sneezing, itchy nose and eyes, congestion, runny nose, and postnasal drip, mucus in your throat. They usually don't cause the facial pain that sinus infections do. COVID-19 can cause additional symptoms, like fever and shortness of breath. A cold, COVID, or allergies can all cause sinus infections. You can test yourself or have a provider test you for some viral infections, like COVID-19 and the flu. Common symptoms of a sinus infection include postnasal drip, mucus dripping down your throat, runny nose with thick yellow or green mucus, stuffy nose, facial pressure, particularly around your nose, eyes and forehead, This might get worse when you move your head around or bend over. Pressure or pain in your teeth. Ear pressure or pain. Fever. Bad breath, halitosis, or a bad taste in your mouth. Cough. Headache. Tiredness. What causes sinus infections? Viruses, bacteria, fungi, and allergens can cause sinusitis. Specific triggers for sinusitis include the common cold, the flu, influenza, Streptococcus pneumoniae bacteria, Haemophilus influenza bacteria, Chastepeidi, Moraxella catarrhalis bacteria. Nasal and seasonal allergies. What are the risk factors for sinusitis? Some people are more likely to get sinusitis than others. Risk factors include nasal allergies, asthma, nasal polyps, growths. Deviated septum. Your septum is a line of tissue that divides your nose. A deviated septum isn't straight, narrowing the passage on one side of your nose. This can cause a blockage. A weakened immune system. This can be from illnesses like HIV or cancer, or from certain medications. Smoking. Sinusitis itself isn't contagious, but the viruses and bacteria that can cause it are. Remember to follow good hand-washing practices. Avoid other people if you're sick and sneeze or cough into your elbow. What happens if sinusitis is left untreated? You don't necessarily need to treat sinusitis. It often goes away on its own. Very rarely, untreated sinus infections can lead to life-threatening infections. This happens if bacteria or fungi spread to your brain, eyes, or nearby bone. A primary care provider may also refer you to a specialist, like an otolaryngologist, also called an ENT, an ear, nose, and throat specialist. Specific tests to diagnose sinusitis. Nasal endoscopy. Nasal swabs. Your provider may use a soft-tipped stick to get a fluid sample from your nose. They'll test it for viruses or other germs that might be causing your symptoms. Imaging. In some cases, your provider might order a computed tomography, CT scan to better understand what's happening inside your sinuses. Allergy testing. If you have chronic sinusitis, your provider may test you for allergies that could be triggering it. Biopsy. Rarely, a provider may take a tissue sample from your nose for testing. Management and treatment. There are many treatment options for sinusitis, depending on your symptoms and how long you've had them. You can treat a sinus infection at home with decongestants, over-the-counter, OTC, cold and allergy medications, nasal saline rinses, drinking plenty of fluids. If symptoms of sinusitis don't improve after 10 days, a provider may prescribe antibiotics, oral or topical decongestants, prescription intranasal steroid sprays. Don't use non-prescription sprays or drops for longer than 3 to 5 days. They may actually increase congestion. Providers treat chronic sinusitis by focusing on the underlying condition. Treatments can include intranasal steroid sprays, topical antihistamine sprays or oral pills, leukotriene antagonists like montelukast, surgery to treat structural issues, polyps, or fungal infections. Prevention. Can sinusitis be prevented? Depending on the cause, there are a few ways to reduce your risk of getting sinus infections, including rinsing your nose with saline, salt water, as directed by your provider. Taking steps to prevent allergies. This includes medications, allergy shots, and avoiding your known allergy triggers, like dust, pollen, or smoke. Using steroid nasal sprays if your provider recommends them. Establishing good hand washing and other habits that reduce your risk of getting sick with infectious diseases. Avoiding smoke. Sinusitis usually only lasts a week to 10 days. You can usually treat it with over-the-counter medicines and at-home treatments. If you have chronic sinusitis, or if it keeps coming back, there may be underlying causes that you'll need to treat. You can usually care for sinus conditions on your own, but if you continue to have symptoms that concern you, or if you get infections repeatedly, talk to a healthcare provider. They can help you understand your next steps. Subscribe to the channel. Reset Health. Reset Life. Share to care for your near and dear ones.